Hello, this is Bill Hughes. I'm with Benefix, and thank you for coming on to the video here for TrueSpot's employee benefit enrollment. And let me get some things pulled up and we'll go right into it. Okay, this is your TrueSpot employee benefits overview for the 2025-26 year. Begins 12/1 of 25, goes through November of 26. And so first of all, we'll talk about deduction amounts for your health plan. You'll see here the payroll deductions, and you'll be changing a triad benefit plan with a Cigna network. Now, it's important to know Cigna is not the insurance company, but Cigna is the network only. So in a little bit, we'll talk about some things, show you things on your card to give your providers and point that out. And it'll show you how to go to the claims payer, who's a third-party administrator, and submit claims. Difference card will still be on, paying the first $4,000. There's a little bit of an increase in some benefits because of the co-payments on this plan versus last year, slightly lower out of pocket. But here you'll see $8.19 for an employee only, and then you see the dependent amounts as well. You can get on, here's a link to get on the Cigna network, and you can find your doctors. Be sure your doctors, providers are on the Cigna network. There's a pretty good bit of overlap with Cigna network and Blue Cross, but it's not 100%. So please get on and check those out. Here's your Humana dental plan and the deductions, $19.44 semi-monthly for an employee, and then you'll see dependent amounts as well. And then the vision plan, $421. So the same plan you had last year. All right, so you still have the difference card this year. This is an HRA. It basically is an overlay. It just lays right on top of your health plan. So I think most of you remember how to use that. The mobile app is available here. There is a website, thedifferencecard.com, and an 888 number, a toll-free number that you can use as well. Here's some instructions on how to swipe and use this. So basically, you give your health insurance card first at the doctor, then any amount they charge you, you can use the difference card. It'll process up to $250 at the doctor's office. Anything more than that, you'll have to submit a claim. Here's the direct deposit information, and you can use this QR code to scan and get that set up. You can also, there's mobile, online, mail, or fax, different ways to get there to get your reimbursement, different ways to submit the claim. The summary of benefits. Here's your summary of benefits. So again, remember Cigna's a network. So you're in network, you have a $50 copay, $100 for specialists. So when you go in and they charge you the copay, then you can pull out the difference card and use it to pay that copayment with. You also have, you'll see prescription copayments here, and then like for diagnostic hospital and network, you'll see those things hit the deductible. And again, your difference card will pay up to $4,000 annually on an employee and $8,000 on a family if you have your family covered. So this is not while this has a large deductible, it is not a qualified high deductible health plan. And with the difference card in place, you cannot use an HSA with it. Okay, so you'll see a second summary of benefits. This is the summary of benefits on the underlying foundational health plan. Shows your large deductible on it is $73.50, and this goes through the benefits on it. Let's see. Okay. These are a little bit of information about some of the providers, and you'll see Cigna is a network. Securus third-party administrator, which is, you'll see actually probably a little different name on a card than that, but that's the company that owns it. But Disclosed RX, pharmacy benefit management. If you get a call out of Disclosed RX about a drug, please call them back because they're setting up to get lower cost drugs, and sometimes they source those differently, and they do have international sourcing available, and sometimes that saves you large amounts of money on specialty drugs. Revive telemedicine. For your telemedicine, you can go to revive.health and set up your telemedicine account. And if you'll get that set up and have your account set up with your medical information, then when you get sick and you want to call in and have that telemedicine visit, it'll go faster. You won't have to spend 30 or 45 minutes getting them all your information and data to set you up as a patient. But telemedicine can be a huge help. I mean, you have colds, flu, it's a weekend, it's night. You can use it 24 hours a day, 365 days a year. And I have used telemedicine, not this particular one, but I've used it a number of times myself. It's really easy. Okay, here's your card. So this is important. Your card basically has an 800 number that you can call. There's also an email that goes to the TPA. And this is not a card for your group, but it's a similar situation through this program. But you're going to see, it says here, have your provider read the red letter things on this card. Do not call Cigna directly for any reason. And the reason is you're not insured through Cigna. They are not your insurance company. We are using a Cigna network. Your plan pays to use that network. It just has contracts with providers for how much to pay. Claims need to go to this address at P.O. Box 188061, Chattanooga. And there's EDI payer number. That's 62301. So electronically, that's how they submit the claims. Claims must be sent to this address because if they send them to Cigna, they will not get paid. And then you can see to find a Cigna provider, you can go to this website as well. There's a number that will be on your card for pre-certification. Don't worry about what's on here. This is a sample. It could even be a different number that's on your card. And then you'll have your well, this one says True Scripts. Yours will be Disclosed RX. It'll have the pharmacy benefit manager on there as well. And to verify eligibility, it'll have the third-party administrator in that spot. Moving on to your Humana Dental. So you have a $50 dental deductible, a $2,000 maximum benefit. Your dental deductible is $150 per family. And you'll see your in-network and your out-of-network benefits here. So pay attention to that. And then your preventive services are covered at 100, basic at 80%, and your major at 50%. And then you'll see back here, orthodontist services, child orthodontists covered through age 18. Plan pays 50%, no deductible of the orthodontic services up to $2,000 lifetime. You have waiting periods here, and so you're a group of 10 or more, so you'll see that there's basically not a waiting period for preventive, basic, or major. But for odontia, it looks like there's a 12-month waiting period. There's an 800 number here. You need to call and talk to a customer care specialist. Okay, here we have contacts. Contacts for Revive Health, for your Humana Dental, Humana Vision, the difference card, and in our office. If you're having trouble enrolling or using the portal to get enrollment done, then call our office. We will be, this enrollment needs to be completed by noon. That's a hard stop, noon Monday, which that's the 17th. So by noon Monday, So don't wait till the last minute, go on and get in and get your enrollment done. Now, if you're not gonna make any changes, if you've not submitted changes through the enrollment portal, then we'll submit what your current elections. If you don't make changes, we'll submit those as they are Monday. So only really need to get in there if you're gonna make changes to your current elections of who is covered. If you want to add people or delete people off your coverage, get on there and please do that. And we have to do this by Monday because we have to get it submitted. We're time wise for December 1, we're just basically running out of time for that. So let's get those in, and got any questions, please give us a call. Thank you.